Good afternoon, everyone, and welcome to the Technical Assistance webinar for the Supporting Vaccine Confidence Notice of Funding Opportunity Announcement. My name is Sean Dade, and I serve as a Public Health Advisor with the National Vaccine Program in the Office of Infectious Disease and HIV/AIDS Policy, also referred to as OIDP, under the Office of the Assistant Secretary for Health. I will be serving as the project officer for this grant. This grant is the collaborative between us, the OIDP, and the Office of Regional Health Offices. I am joined today by my OASH colleague, Dwayne Barlow, who works in our Grants and Acquisition Management Office. Next slide. Today, we will provide an overview of the Funding Opportunity Announcement, NOFO, and the competitive application requirements. This technical assistant webinar is being recorded and will be posted for the duration of the competition. All participants have been muted. We invite you to submit questions at any time during the webinar using the chat window on the right side of your screen. Please ensure that you select the option to send your question to all panelists. We will review the questions and address them in an FAQ document. This document, along with the slides and the recording of the TA webinar, will be posted to grants.gov as soon as possible. Please note that the information provided in this call does not supersede any of the content of the NOFO. The NOFO is the written document that will govern the competition. We strongly encourage you to subscribe to the NOFO on grants.gov to ensure that you will receive notice if there are any revisions made to the NOFO. Next slide. Please be informed that the Notice of Funding Opportunity is available to provide you with essential information and guidance regarding applications. It is highly recommended that you read the entire funding announcement and follow the NOFO carefully. Please note that the information provided in the NOFO takes precedence over any conflicting details in other documents. Next slide. This initiative seeks to support the expansion, planning, implementation, and evaluation of promising practices and develop novel approaches that help to increase vaccine confidence in local communities, particularly partnerships with organizations that demonstrate the ability to work with underserved populations with low vaccination rates. As vaccine hesitancy continues to grow throughout the country, practical solutions are needed at the local level to support vaccination efforts in communities by various immunization stakeholders, such as healthcare providers, health departments, immunization advocates, and other partners within the vaccine ecosystem. Next slide. Projects awarded will contribute to the following programmatic goals for this funding opportunity. The first goal will be to develop locally tailored innovative intervention strategies that address vaccine confidence barriers identified among the targeted populations. These intervention strategies will lead to increased vaccine confidence, allowing for vaccinations to be a routine part of community vaccination programs, particularly among underserved populations with low vaccination rates. Throughout the duration of the project, you will be working closely with various partners in the local community to build trust and assist with identifying barriers that are preventing confidence in vaccines. Next slide. We encourage applicants to work closely with higher education who has a trusted relationship with the population of focus to conduct evaluation activities. When developing publications and reporting briefs, include the partner network and population of focus to ensure transparency and credibility of the results. When developing your project, develop a wide range of network members, which should include various immunization partners such as public health departments, community organizations, coalition groups, medical organizations, and other partners that service individuals with low vaccination rates. Next slide. For these next few slides, I'm going to share the expectations for the funded projects. Expectation 1, we want funded projects to build and maintain partnerships with local communities to determine what specific barriers are preventing confidence in vaccine uptake. By the end of the first 6 months, the recipient should have engaged and established strong partnerships with a network of organizations that work with identified target populations. To identify the barriers preventing vaccine confidence, recipients should conduct a community needs assessment utilizing a variety of data capturing tools such as community forums, focus groups, and surveys. Once the data has been captured from the community assessment, recipients should analyze the data findings to determine what specific unique barriers are negatively impacting vaccine confidence among the identified target populations. You will need to work closely with your network of partners to address these barriers. Next slide. The second expectation is to develop locally tailored intervention and evaluation plans to increase vaccine confidence in target population. Recipients should use findings from their community needs assessment to develop community-level interventions that will reduce barriers among their target population. Recipients should effectively track, measure, and monitor the effectiveness of these intervention strategies and be able to adjust intervention strategies as needed to meet the needs of the target population. These strategies developed by recipients should be innovative approaches that reduce vaccine hesitancy, leading to increased vaccine uptake. Next slide. The third expectation for funding projects will be to evaluate project processes and outcomes to ensure project effectiveness. We expect recipients to evaluate these processes and outcomes to assess project effectiveness and impact throughout the direction of the period of performance. The evaluation of the project should include determining if the community-level innovation was implemented as planned, determine whether the project reached the intended population of focus and impacted health incomes for that population. Recipients are expected to build on and refine baseline population data used in the application with additional data points provided throughout the course of the project to measure effectiveness. Recipients are expected to participate in technical assistance offered by the Office of Infectious Disease and the Office of Regional Health Operations. Next slide. The fourth expectation for funding projects includes sharing information about the project and its findings with the public. We expect recipients to document and share project findings and results with network partners, the public, and other interested parties. Recipients will share project information with other OIDP or award recipients within the period of performance. Recipients will also share findings and results at local and national public health conferences and or also write briefing reports. Recipients are encouraged to work closely with their network of partners when developing publications to ensure transparency and credibility of the results. Next slide. Now I'm going to talk about the application content. This information can be found on pages 16 through 24 of the NOFO announcement. Next slide. This slide is a visual display of the information that you will need to ensure you have a successful application. This includes a project narrative, content, a budget narrative, and appendices. I will speak to what is needed within the project narrative, and Dwayne will discuss what is required for the budget narrative and the appendices. Please review your application to ensure this information is included within your application before submitting to grants.gov. Next slide. We recommend your project narrative includes the following components. This includes information on project significance, proposed approach, evaluation, dissemination, and organizational capability. I will touch on all 5 components of the project narrative. Next slide. For project significance, describe the nature and scope of the specific vaccine confidence demonstration project and how it is designed to address this issue. Use available national and local data to explain how you selected the low vaccination underserved population. Include in quantitative and qualitative terms the project's population and geographic areas of focus and related gaps and barriers to effecting change. Describe the significance of your proposed community-level innovation on promoting vaccine confidence for underserved and disadvantaged populations in a broader public health context. Emphasize how your project will affect use of preventive health services as it relates to vaccine uptake and preventing vaccine-preventable diseases. Next slide. The second component of your project narrative should include a proposed approach that includes goals, objectives, and outcomes. Describe your project's proposed goals and major objectives associated with each goal. Use baseline data and quantitative timeframes to describe SMARTY, specific, measurable, accurate, relevant, time-bound, inclusive, and equitable objectives. Connect proposed goals, objectives, and outcomes to the activities described in your work plan. And also make sure your outcomes are reflected in your logic model. Next slide. Your project approach should also have a project plan. Within this plan, make sure to explain your approach and activities, describe how your community-level innovations will address vaccine confidence barriers, Propose an approach for developing activities. Apply a community-level public health improvement model. Include information on the nature of activities, partnerships needed for implementation of activities, and any anticipated barriers or challenges your project may have to overcome. Next slide. Your project approach should also include information on project management as it relates to how strategies will be monitored and tracked to ensure project integrity. Describe who will oversee and maintain partner engagement to accomplish project activities. Explain a plan for risk management, which includes managing staff transitions, and also describe your organization's leadership role on oversight of the project. Next slide. The third component of the project narrative is evaluation. A good evaluation plan will include SMART goals, an evaluation plan tying individuals or organizations to evaluation activities, overseeing of project outcomes to ensure progress towards reducing vaccine confidence is related to barriers, a collection of baseline, interim, and post-intervention data related to process and outcome measures. Next slide. The fourth component of the project narrative is dissemination. Describe the methods you will use to disseminate the project's results and findings to stakeholders interested in using the project results. Include any innovative approaches as well as traditional forms of dissemination, such as abstracts or presentations at national public health conferences. Consider how your results may inform practice, service delivery, program development, and policy making. Next slide. The fifth component and the last component of the project narrative is organizational capability. Summarize your organizational capability and capacity to successfully implement the proposed project. Include your organization's current mission, scope of activities, and readiness to demonstrate impact within the period of performance. Describe your organization's experience with successfully administering grant projects of similar size and scope related to vaccines. Refer to the organizational chart in your appendices to show the relationship of the project to the overall organization. Next slide. Included in the fifth component is community-level expertise and collaborative partnerships. Describe your organization's experience and capability to form a collaborative network. Describe your partnerships with community-based organizations such as CBOs, local health departments, and other community-based affiliations who work with trusted messengers or community health workers to increase vaccine confidence. Describe the network's ability to engage in community-level strategies within the population of focus. Describe the network's members' anticipated level of effort and responsibility for completing programmatic activities. Next slide. You also want to make sure you include in your organizational description when referring to your organizational capability. This includes summarizing your organization's capability and capacity to successfully implement the proposed project. Include your organization's current mission, scope, and activities. I'm sorry. Can you go back one slide? I'm sorry. Okay, no, I'm sorry. You go ahead. Move forward again. I'm sorry about that, Bill. The fifth component also should include organizational capability, which includes project staff and key roles. Identify the individual who will be on the project director, principal, investigator, and any additional key personnel whose contributions are essential to the project. Specify who would have day-to-day responsibility for key tasks, such as project leadership, monitoring the project's ongoing progress, preparation of reports, and communicating with the collaborative network. Next slide. Now I'm going to talk about the application criteria during the review process. This information can be found on pages 30 through 32 in the NOFO announcement. Next slide. The applicant will receive up to 20 points for project significance. The degree to which the applicant demonstrates project significance through national and local data describing low vaccination rates for the population in geographic areas of focus. Provides evidence for potential impact on the use of vaccine confidence intervention strategies for individuals with populations of focus who experience health disparities. Describes the extent to which the proposed innovation will impact underserved populations. Next slide. The applicant will receive up to 20 points for proposed approach project plan. The degree to which the applicant provides a concise, well-supported description of and rationale for the approach, the nature of activities and why they were selected, including addressing system gaps and identified challenges. Describes the anticipated contribution of partners to the project through ongoing planning, quality improvement, implementation, data collection, and evaluation. Adequately describe the community-level public health interventions that will strengthen the promotion of vaccine confidence to achieve the intended outcomes. Clearly summarizes proposed activities in a work plan that includes major tasks, action steps, products that will be developed, timeframes, and persons, partners responsible. Next slide. The applicant will receive up to 20 points for organizational capability. The degree to which the applicant demonstrates the capability, infrastructure, expertise, and readiness to successfully conduct project activities. Demonstrates the ability to establish a collaborative network capable of partnering in community-level innovations that reduce vaccine confidence barriers among the identified target population. Clearly illustrates the network's ability and readiness to engage in project activities. Adequately describes key personnel roles and responsibilities, including identification of the PDPI, and describes their qualifications, competing time commitments, and level of involvement with the project. Next slide. The applicant will receive up to 15 points for project goals and outcomes. The degree to which the applicant demonstrates a strong and clear alignment of goals, objectives, and measurable outcomes to implement the innovative approach to increase vaccine confidence by reducing identified barriers among the target population. Clearly describes objectives that are each specific, measurable, achievable, realistic, time-bound, inclusive, and equitable, SMARTY, using baseline data that includes quantifiable timeframes for achievement. Includes appropriate, measurable outcomes expected from the proposed project. Next slide. The applicant will receive up to 10 points for proposed approach project management. The degree to which the applicant describes a feasible approach to monitor and track project progress at a task level. Clearly illustrates how partners will be managed to accomplish proposed project activities and provides a feasible approach to risk management and a plan for managing key staff transition. Next slide. The applicant will receive up to 10 points for project evaluation. The degree to which the applicant employs a process and outcome evaluation approach to analyze the goals and objectives, presents reasonable methods for evaluating project achievement of SMARTY objectives and measurable outcomes, describes how outcomes of the project will be monitored, documented, measured, and reported. Description of quantitative and qualitative tools and techniques and how lessons learned will be identified and documented. Next slide. The applicant will receive up to 5 points for dissemination. The degree to which the applicant proposes traditional and innovative methods to disseminate the results and findings of the demonstration project and its impact in a timely manner at an appropriate scale, either national, regional, or local. Describes a feasible approach for disseminating project data and information to the populations of focus, the public, and other parties who may be interested in applying methodologies and lessons learned to their own work. Next slide. And that concludes my portion of the presentation. I will now turn it over to Dwayne. Dwayne, the floor is all yours.
Thank you very much. Good afternoon, everyone. My name is Dwayne, and again, I am from the GAM office, the Grants and Acquisitions Management Office. And at this point in the presentation, we're going to discuss the application piece of our presentation. So as we see at the bottom here, the competitive application deadline is Wednesday, August 21st, 2024, and the cutoff time is 6 p.m. Eastern Time. Next slide, please. Again, just so that you guys are aware, the application is due by 6 p.m. Eastern Time on Wednesday, August 21, 2024. Keep in mind that your submission time will be determined by the date and timestamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Keep in mind that grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will not receive further consideration. Next slide. Okay, with regard to eligible applicants, eligibility for this NOFO is any private, either profit or nonprofit or public entity located in a state is eligible to apply for an award under this NOFO. State includes, in addition to the several states, only the District of Columbia, Guam, the Commonwealth of Puerto Rico, the Northern Mariana Islands, the Virgin Islands, American Samoa, the Trust Territory of the Pacific Islands, and any agency or instrumentality thereof exclusive of local governments. Eligible entities include private, not-for-profit, or public faith-based organizations, community-based organizations, and American Indian, Alaska Native American organizations. Next slide, please. Cost sharing and matching for the project. So you're not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification as described in Section H, or your application will be disqualified. Voluntary cost sharing is not expected for research applications. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, federal and non-federal share, to support the project proposed. Awarded applications, including cost sharing or matching commitment, whether required or voluntary, will include the commitment on the notice of award at the level proposed in the application. Any change in the cost sharing or matching commitment will require prior approval of the grants management officer. Next slide, please. Application responsiveness criteria. So we will review your application to determine whether it meets the responsiveness criteria below. If your application does not meet the responsiveness criteria, we will disqualify it from competition and we will not review it beyond the initial screening. So here's the responsiveness criteria. The project abstract summary must state the current vaccine rate of the community of focus for the project. Next slide, please. The address to request application package. So you can obtain an application package electronically by accessing grants.gov at the URL that you see on the screen right now. And you can find it by searching the assistance listing number found on page 1 of the NOFO. The assistance listing number for this particular NOFO is 93.344. As was stated earlier, please be sure to subscribe to the announcement in grants.gov so that you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OISH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Keep in mind that grants.gov is a website portal. All funding opportunities and grant application packages are made available on www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by the OISH Grants and Acquisitions Management Division according to the deadline specified in the submission dates and time section of the NOFO. You can contact grants.gov with any questions or concerns regarding the application process at 1-800-518-4726. Next slide, please. So all applications must be submitted as 3 files. File 1 should be the entire project narrative. File 2 should be the entire budget narrative, including supporting documentation described in the budget narrative content section of the NOFO. File 3, all documents in the appendices section. Please note, required standard forms do not apply towards your page count limitations and the submission requirements as stated in the disqualification criteria in section C of the NOFO. Next slide, please. Any files uploaded or attached to the GrantStub application must be of the following file formats. So you can use Microsoft Word, you can use PowerPoint, you can use Adobe PDF, or the following image formats. You can use JPEG, GIF, TIFF, or BMP only. Please keep in mind that Microsoft Excel files will not be accepted. HHS.gov strongly recommends that electronic applications be uploaded as an Adobe PDF. If you convert to PDF prior to your submission, you may prevent any unintentional formatting that might occur with the submission of an editable document. Please check your page count of your PDF and/or print your file to ensure that the document does not exceed the page limit. Next slide, please. Keep in mind with regard to your application submission that you want to be complete and do not leave any blanks on forms unless the information is clearly not applicable. Keep in mind that the individual submitting the application forms must have the legal authority to act on behalf of the organization. Next slide, please. To ensure successful submission of your application, carefully follow the step-by-step instructions provided at the URL that you see here below. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. All right, now application elements. So with regard to forms, you're going to need an application for federal assistance, or the SF-424, the budget information for non-construction programs form, or the SF-424A, the disclosure of lobbying activities form, or the SFLLL, and your project abstract summary. So with regard to files, the project narrative, submit all project narrative content as a single acceptable file. For the budget narrative, submit all budget narrative content as a single acceptable file. So appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. Please be sure to follow the project narrative format instructions in NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified in the project narrative. Appendix documents such as resumes may use alternative formats common to such documents. Next slide, please. The System for Award Management, or SAM. Okay, so if you are registering a new entity in SAM.gov, you need to create a login.gov account if you don't already have one. If you are renewing your registration, your old SAM.gov username and password will not work anymore. You'll need to create a login.gov account if you don't already have one. Keep in mind that the minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for applicants, AIR applicants' registration to become active is up to 10 days and may take longer depending on volume. SAM registration must be renewed each year. The average time frame for updates in SAM.gov to appear in grants.gov is up to 72 hours. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. So if you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you have not complied with the SAM registration requirements, HHS may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Keep in mind that should you successfully compete and receive an award, all first-tier subaward recipients must have a UEI number at the time that you, the recipient, make a subaward to them. Next slide, please. Funding restrictions. If you are successful and you receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of the award, other department regulations and policies in effect at the time of the award, and any applicable statutory provisions. Keep in mind that costs must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulation and current policy. Indirect costs may be included per 45 CFR 75.414, and applicants should indicate which method or rate will be used for this application. Keep in mind that pre-award costs are not allowed. Current salary limitation is $212,100 effective January 2023. Next slide, please. Budget narrative and forms. Keep in mind that must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. The suggested table formats are also included in the NOFO. And you also want to take a look at within the NOFO information about the plan for the oversight of federal award funds. Keep in mind that forms, narrative, and detailed justification do not count toward page limit. Next slide, please. Application disqualification. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. Keep in mind, I apologize, that your application must be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. Keep in mind that if you successfully submit multiple applications for the same project, we'll only review the last application received by the deadline. Your application will be disqualified if we deem that when I say we, I mean HHS.gov deems your application ineligible. Keep in mind that your project narrative must be double-spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides and font size not less than 12 points. The project narrative must not exceed 30 pages. The total application, including project narrative, must not exceed 60 pages. Next slide, please. If your application does not meet the following requirements, it will be disqualified and will receive no further consideration. Your application must be in the English language and must be in terms of US dollars. Your federal funds request, including indirect costs, should not exceed the maximum indicated in the award ceiling. Your federal funds request, including indirect costs, must not be below the minimum indicated in the award floor. If you have included voluntary cost sharing or matching, you must include it in your budget narrative, a non-federal sources justification. You have to keep in mind that your application has to meet the application responsiveness criteria. Next slide, please. And again, the responsiveness criteria is that the project summary must state the current vaccine rate of the community focus for the project. Next slide, please. Supporting documentation and disqualifications. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application's rating under the evaluation criteria, so please be sure to follow the submission instructions within the NOFO carefully. Next slide, please. On this slide, we just wanted to remind you of the application review criteria. Next slide, please. Application merit review. Eligible applications will be evaluated, commented on, and rated by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFO. The merit review process is formal and confidential. Federal staff are available for questions and to ensure that the process is consistent and fair, but do not participate in discussion and scoring. The applications are then also reviewed by GAM staff for administrative and business compliance, and then by OIDP program office staff for programmatic compliance. Next slide, please. Funding decisions. So the director of OIDP will provide recommendations for funding to the grants management officer for risk analysis. In providing these recommendations, the director of OIDP will take into consideration the following additional factors. In this case, it would be equitable geographic distribution. Upon completion of risk analysis and concurrence of the grants management officer, HHOASH will then issue notices of award. Keep in mind that no award decision is final until a notice of award is issued. All award decisions, including the level of funding, if an award is made, are final and you may not appeal. Next slide, please. The funding process. Keep in mind that we're not obligated to make any federal award as a result of this announcement. Only the grants management officer can bind the federal government to the expenditure of funds. If you receive communications to negotiate an award or request additional or clarifying information, this does not mean that you will receive an award. It only means that your application is still under consideration. All award decisions, again, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Okay, so the funding process, review of risk posed by the applicant. So HHS-OASH will evaluate each application in fundable range for risk posed by the applicant before issuing an award in accordance with 45 CFR 75.205. OASH will use a risk-based approach and may consider any items such as the following as stated in the NOFO. So we'll take a look at the applicant's financial stability, the quality of management systems, and the ability to meet the management standards as prescribed in 45 CFR Part 75. We'll take a look at your history of performance, reports and findings from audits performed, and the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. The plan for oversight of federal award funds. If your internal controls are available online, you may provide the link as a part of your plan in the budget narrative. We've also included supplementary information in section H5 of the NOFO, which contains questions applicants may find useful in considering their recipient plans for oversight of federal funds. Next slide, please. Risk review resulting in non-funded determination. So if we determine your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75.205A2, and we don't make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. Keep in mind that the information reported in FAPIS is available for other organizations to review when considering you for an award. Next slide, please. The notice of award. So, a notice of award to be received notifies the successful applicant of the selection, the award amount, project, and budget periods. It includes any conditions on the award, i.e. requirements that must be met as a condition of receiving the grant funds. It also includes standard terms, reporting requirements, and contact information for OASH GAM and the program office. Next slide, please. With regard to the funding process and points of contact, keep in mind that GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by program office via letter. Next slide, please. So here's a summary and some tips. So with regard to the project narrative description, you want to be clear, complete, and concise in the project description. You want to follow and address exactly what is requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating. Reviewers are not allowed to do external research or follow embedded links, etc. You want to clearly define the sections of the application and indicate which component is being addressed. Project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. You want to make your goals that was stated before an objective, smart, specific, measurable, achievable, realistic, and timeframe. Activities presented in a work plan should relate directly to the proposed goals and objectives. The program, work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations in the NOFO. Next slide, please. With regard to staffing, the staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. So you want to be complete in describing what the staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. With regard to the budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income from fees and third-party payers and other contributing funds. Next slide, please. Overall, we encourage you to use individuals' full names, first, middle, and last, to distinguish them for verification in the SAM exclusion records. Electronic submission is required. Don't wait until the last minute to begin SAM registration or update your registration. Do not wait until the last minute to begin the electronic submission. Problems could arise. Next slide, please. If you receive an award, only one project director / principal investigator, or PDPI, will be named on the award documents. So you want to clearly identify the individual to be the PDPI in your application. We typically expect this to be the person named on the SF424 in box 8F. Do not use a placeholder or honorary PDPI because this does not present an accurate picture about who will be responsible for the day-to-day management of your project. If you have not hired an individual to be the PDPI, you should name an interim PDPI and clearly identify that person as such. If you receive an award, a request for a change in PDPI or key personnel under any circumstance requires prior approval of the grants management officer before it becomes effective. Next slide, please. So if you have questions about this NOFO, with regard to program questions, you can reach out to Sean Day. His email is listed here on the screen, as well as his telephone number. If you have administrative or financial questions, you can reach out to me, Dwayne Barlow again, and my phone number is also listed here on the screen. With regard to electronic submission requirements and grants.gov applicant support, you can use the URLs that we have listed here. They have an email address that can be used. And again, you can call them directly at 1-800-518-4726. Keep in mind that you should not contact the OASH program or grants office staff for grants.gov issues because we don't manage that site. Next slide, please. So at this point, I'd like to turn it over to Sean. Thank you very much for your attention.
Thank you, Dwayne. So as I said at the beginning of this webinar, we're going to take all the questions that we received in the chat box, and we're going to develop a FAQ document that's going to be shared with this recording and the slides to grants.gov as soon as we can. And that concludes this technical assistance webinar. We're going to stay on for the next 5 minutes just to ensure everyone has time to write down their question in the chat box. So that concludes the TA webinar. Thank you.